A very warm welcome to you, and thank you for joining us on Health and Wellness. My name is Zaitun Ali. Thank you for staying tuned every single Sunday at 6 p.m. right here on KTN Home. And today, the topic of discussion is actually a good one. We're talking about telemedicine in Kenya. Have you ever found yourself like you're so tired of going to make those long queues at the hospital? You've been told you have to book an appointment. So the doctor can only be seen next week on Tuesday, and we're just Wednesday right now, and you need to see the doctor soon enough. Yeah. So telemedicine deals with that. And right here in studio, I have Dr. Mukeira Gisairo. She is a health advocate from Bayon 8. Karibu sana.
Thank you.
Good to have you. We also have Dr. Hadima Moroa. She's a medical officer at the Health X Africa. We're happy to have you in studio.
Thank you for having me.
Nakwambia awa ndo wamemodernize, digitalize healthcare right here in Kenya. And we are here to hear more from you guys. We appreciate actually how we've been able to move with trends even in the healthcare sector. So Mukeira, and I'll throw this question to you. Just talk to us about what telemedicine is in a nutshell.
Okay. Telemedicine is the use of technology to deliver healthcare. So patients are able to get healthcare services without necessarily having to go in person to speak to the doctor. Okay. You can be in Turkana and you're still able to use that device and that platform to talk to a doctor who is in Nairobi. Yes.
Okay, that makes sense. Dr. Hadima, you guys, most of your services are on the digital platform. Yeah. How have you been able to manage that right now in Kenya?
Actually, we have a lot of uptake of these services. People are, as you're saying, they don't want to go in person to hospitals, long queues, long waiting times. So we are able to have virtual consultations and audio consultations with patients. They call in, they speak to a doctor, they explain themselves. If they need a prescription written, we are able to do that. If we need to send them to the lab, we are also able to do that. And patients are satisfied because we are able to treat them in a timely manner. You send the prescription in a timely manner, they're able to go to a pharmacy that's near them, or even we can be able to have the medication delivered to where they are at the time when they're calling us. And that has made it easy for them, to be able to get the services that they need in terms of health.
Okay, that makes sense. Could you just paint a picture probably of one service that you guys offer that is on the digital platforms?
Okay, so for example, a patient would call in, maybe they're not feeling well. Let's give an example, maybe they have a headache. So they call in, they are registered to our services, then they're able to speak to one of the available doctors. So what a doctor does is they do an assessment of how the patient is. A good number of patients, we are able to treat them from where they are. As telemedicine, we recognize that there's some situations that are emergencies that this patient has to be treated, in person at the hospital, receive emergency services. But once we've assessed and ascertained that they don't need emergency services, then we are able to, complete the consultation, figure out what they need, and be able to send them a prescription so that they can get the medication. And
actually, the case of that emergency that you're talking about, you're also able to recommend probably an ambulance to come by. Is it part of the service as well?
Yes. If the patient is able to, we are able to recommend, usually we recommend they go to a facility that is near to them, because of how fast the service needs to be. But we are able to link them up with an ambulance service so that they receive timely care.
Okay. Mukeira, Daktari, and most of what you do, especially on the social media platforms, you create awareness on even Instagram. Can you just talk about content creation when it comes to now healthcare?
Okay. Health information is a determinant of your health outcomes. The information that you have allows you to make decisions either to prevent a particular condition or to go in to get tested for a disease at a particular stage, so you're able to have that early diagnosis. So people are only able to prevent or early treat a particular condition in the early stages when they know what exactly they're watching out for. So there is a very low level of health literacy among the population, and that's why personally as a medical doctor I feel like it's very important for me to use my platform to help people get a bit more information that at the end of the day is really life-saving. So we're able to discuss different conditions, how to identify emergency situations, and when you find yourself in an emergency situation, how you're able to know which is the right hospital for you to go to, what is the right kind of facility you need to choose. Sometimes you might be with someone who is collapsing, and you might feel like the dispensary is the nearest point of care you can go to, but that's not where you're going to get the care you need at that point. So also equipping people with the knowledge to know what is the correct facility to choose for what instance. So there's a lot of health information that is lacking in the population, and I feel like that's what I try to do, a video at a time.
Okay, that makes sense. And I know you've been in this space for a very long time, and you can probably compare in terms of efficiency, telemedicine and the kawaida, if I may call it linear kind of, healthcare services. Compare the efficiency.
The benefits of telemedicine are wide range. There are very many. If I could paint a picture, using the BioNaid platform, for example, I wake up today and I have a headache. Instead of me getting into a matatu, staying in traffic for 2 hours, going to queue in the hospital, I can get onto the platform. Initially, since they have empowered you to take your health control, you can go into the app. It will ask you a few questions using the symptom checker to try and categorize what exactly are you suffering from, and then it will give you a few recommendations of what it could be. Each of these recommendations comes with a pointer. Do you need to seek emergency care? Do you need to seek primary care? Then after that, you can still go ahead to book a consultation with the doctor on the same platform. After having the consultation with the doctor, if you need a prescription, they will write you the prescription, and you're able to fulfill it either through the same platform, or if you decide to have it purchased using through a pharmacy near your location, you can also do that. If you need lab tests, we're also still able to refer you to our partner facilities to do that. So at the end of the day, you've saved time that you would have spent on traffic. You've saved time you'd have spent waiting. You've saved money because telemedicine is here, to make healthcare more accessible, especially in terms of finances, and it's more convenient. So anytime you feel like you're unwell, you're least likely to postpone it because it's something convenient that you can easily do now. Because the culture you have, unless you're dying, people will not go to the hospital.
I know. And it's not even that. It's the point whereby you're being told you need to book an appointment to see the doctor. So me nasikia vibaya leo. Kesho sizi muona because now the doctor will come probably on Saturday or next week, you know. So those things actually make people feel very inconvenienced, and you're like, it's never that serious. Let it slide. So I hope it's working actually. And even as we're marking today is World AIDS Day, and we just want to talk about certain angles in terms of counseling and guidance in counseling. And this question I have to throw it to you, Hadima. How do you guys ensure that we are able to give guidance and counseling on such platforms and ensure even the privacy of the patients are not infringed in any way?
Okay. Today being World AIDS Day and following the theme, take the right path, my health, my right. Every patient who is living with HIV, living with someone with HIV or affected in one way or another, has a right to access healthcare. And through telemedicine, we're able to do this. At HealthX, we have clinical psychologists and we have a nutritionist as well who are able to guide these patients. So if they call in with a particular, concern, for the doctors, we're able to give them sound advice on how to deal with that particular concern they have. If they're going through mental health issues, we are able to provide them with a clinical psychologist who can guide them through the journey. And also, together with the nutritionist, they're able, wellness, as we're speaking, to come up with a plan that will take care of them holistically. We're just not looking at them only taking their medication, but them living a fulfilling, holistic life. So, they're advised on diet, they're advised on exercise, their mental health is catered for, and we're able to do all this through our telemedicine platform. This patient can do it, at the comfort of their home. They don't have to get into a vehicle to come to the hospital and visit a doctor. And this means that more patients are able to access more than just, the medical care, but the holistic care through telemedicine.
It's even actually more private.
Exactly. It is more private. If they have the concern that they do not want stigma, we're able to address that through counseling. We assure them that their data is safe, it's private. We have a whole department that works 24/7 to ensure that their data is, private and it does not leak to the wrong hands. And therefore, these patients are assured that, you know, they're receiving good care and that, you know, they're not going to be stigmatized because their data is kept safe.
Okay. Yeah. Okay, Dr. Mukira, as we're talking about Bion 8, I don't know how it works exactly, but you can explain to us, and in terms of challenges, have you come across any in terms of technical challenges or any other?
Okay, maybe I can give a run through.
Yeah.
Bion 8 is an AI-driven healthcare platform that is innovating solutions that allow you to go beyond the limits of the traditional healthcare system. Okay. So you're able to do things that typically you would not do in a brick and mortar facility. One of the things that we've come up with is a symptom checker that allows you to have more control of your health.
Oh,
yes. When you wake up and you feel like I'm having a headache and you go check your symptoms online, you will see cancer, death. So instead of having these extreme suggestions, we have an AI-driven symptom checker that allows you to answer a few questions that help characterize the symptoms you have more, and it will give you more personalized recommendations of what could be happening. And even after that, then you can go on to speak to a doctor and to get the care that you need, if what you need requires that consultation with a doctor.
Okay, so actually it knows, it can depict the trends and the behaviors of the patients.
Yes.
And now give you consolidated now what recommendation.
Yes. The AI engine has been in development for the past 4 to 5 years.
Okay.
And currently it's 92% accurate. So yes, that's been a lot of research and a lot of data. Yes. Yeah.
That's a good one.
Yeah. So some of the challenges I feel like we would experience, because it's heavily AI focused, then you would need a smartphone to access the service. Unfortunately, you're not able to access this using a feature phone. So there's that kind of segmentation, but we're working every day to ensure that the solution is more inclusive. So aside from that, you would also need stable internet connection. Sometimes in the really remote areas, you might find there's that interruption in the internet connectivity. So that would be another challenge. But these are things that are not within our control. So
I know,
every
the digital divides. It happens, and I'm sure probably sooner than later, everyone will be owning a smartphone. Yeah. So we just need to start from somewhere as we go with these trends. Yeah. And based on Bion 8, actually, that you're talking about. Yes. So apart from now telling you the symptoms, there's even a watch I came across that if you wear it, it can tell you if you're about to get a heart attack. Like it can predict probably certain conditions and illnesses that are bound to get you. Yeah. So does this also work like that?
There are other features apart from what I'm mentioning, maybe the symptom checker and the telemedicine feature. You can have a consultation with a doctor.
Yes.
In addition to that, we have a lifestyle and wellness section where the platform is able to key in your data, whether it's a physical activity, calories you're burning. So there's also that wellness aspect of it. Yeah. And anything that deviates out of that is able to give certain recommendations. Aside from that, there's a wellness and nutrition section where the different types of diet, if I'm on a diabetic diet, I can go there and it will tell me this is what you're supposed to be eating, this percentage of carbohydrates, and give me exact recipes of what I'm supposed to be taking. Okay. So it's holistic, and aside from the curative aspect of it, there's also the preventive aspect.
What about customer satisfaction? And I know this is the question. So many people are very skeptical in terms of now starting to use telemedicine. Yes. How satisfied do they say they are? And are they normally comfortable sharing their problems, their illnesses with someone strange who probably can't see? Probably, how does this work?
Okay. When it comes to especially Bion 8, you have different options. You can have the consultation via text, or you can decide to have a video consultation. If you're having a video consultation, I'm the same doctor you'll find in the physical facility when you come. Okay. It's just that the platform is different. Right now you're seeing me through the screen. There's a pilot project we had in partnership with the county government of Muranga, where we enrolled some patients with non-communicable diseases, and when they were previously not able to find a doctor in their level 3 facility, we're able to set up a telemedicine station, and they could now talk to doctors, and after a while you would find them saying nataka kuongea na daktari wa TV. So because they had already established that connection and
daktari wa TV.
That's it. So So initially people will be skeptical because it's just the natural human response to change. Yeah. But once you get to interact with a few patients and establish that trust, as you would even in a physical facility, because this is still someone you don't know.
Exactly.
Yeah. So there's that human element to it, where you come and speak to the patient and they see you're a person. and they're more receptive.
Yeah, but I think we are a step forward towards probably not a rebuke, but if it may come a pandemic or something. Right now, people can access quality healthcare services even if you're quarantined. I wish we had that time for COVID-19. But let me ask you, Dr. Hadima, how is the response in terms of? And I know we have one of your beneficiaries right here in studio who will join us at the second part of the show. His school actually took up a program from you guys. Probably talk about that.
Okay, so we are able to partner with different companies, with different schools, where we are able to offer them telemedicine services. So for example, we could have a school we've partnered with, and maybe if it's a boarding school, the children there, it's a closed facility. If maybe one of the pupils, one of the students is not feeling well, there is a nurse that's stationed there, that's their station, that's where they are. So they're able to assess this child. They take their vitals, that is, they take their temperature, they measure their weight, they take their respiratory rate, things that you would need before a doctor is consulted. Then they're able to call us via audio or video. Both ways are possible. We give them a consultation. We're able to assess them. We can send them for labs if we need to. We can send them for imaging if we need to. And then we write a prescription if it's indicated. And at the same time, we also have consent from parents of these students. So, once we have treated their children, they are contacted and they're told that your child has been treated and is doing well now.
Okay. And in terms of the audio and video, like you're saying, are they up to standards? Are they of quality, probably imagery and everything? Or mnapatanga connections zingine imekatika, daktari unamuona ni kama haumuoni kidogo? How are they?
Shake. For the most part, I find that it's okay. So some diagnoses are visual, so it's important that you have good video quality, which HealthX has done its best to provide. So we are able to see exactly what the patient is complaining about. If they have maybe a wound somewhere, we're able to see it. If they have a swelling somewhere, we're able to see it. At the same time, there's a nurse who is a medical professional.
On ground?
There. Yes, on ground. So if there's something you feel you want her to check and explain to you, for example, if the patient says they feel pain when they're swallowing, she can be able to, shine a torch into the throat and visualize and tell you, doctor, I'm seeing the tonsils are swollen, and you'll be able to take action from that.
So that nurse is part and parcel of your service?
That nurse is part and parcel of the service.
Okay.
Yes, and she's stationed there, or he's stationed there as part of HealthX team.
Okay, that makes sense. And in terms of scheduling the patients, the appointments, timekeeping, do they normally keep time, or how does that work?
For the most part, yes. We are able to send them, SMS reminders. If maybe a patient, we have the patients who have the non-communicable diseases, the diabetes, hypertension. If a patient has an appointment with us, or even with the nutritionist or with the mental health team, we're able to tell them in advance that you have an appointment on this date at this time. And usually we find that, time keeping is not much of an issue. We're able to have the consultations on time.
So at least AI is bringing personalized treatment to each and every customer and client out there. Dr. Mukira, probably as you're looking at it, what seems to be the future of telemedicine really right now?
Okay, I think with continued innovation, we'll be able to have more inclusive solutions. Right now, maybe you might find someone is creating just for people who have smartphones, others are creating just for SSD codes. I think they will be more unified or more cross-cutting. They will also be more personalized. So using AI, we'll be able to have the predictive insights to know exactly how we can prevent something based on your risk factors and your environmental exposures. So I see a future where people are more receptive of telemedicine, because that is where the future is. And also we're having more personalized solutions for the patients.
Okay. And Dr. Hadima, even as we're taking this short commercial break, I'm sure people would like to know, even in cases of chronic diseases, how do you treat them now through telemedicine?
Okay, so we have a program where we cater to these patients. So they can call us as long as you have a phone, actually. It does not have to be smartphone, even the normal phones. You can call us through our toll-free number. We are able to book you into our program. So we do it how it would similarly be done in a physical facility. So we take a history, if they have any prior labs that they've done, they're able to send it through email. We can be able to review. From there, we can be able to check if their current condition is well controlled. In telehealth, we know our limits. Therefore, if you feel that a patient's condition is not well controlled and they would benefit from seeing a doctor who can examine them, we advise them. But otherwise, if they are well controlled, or we can actually control them from the comfort of their home, the comfort of their office, we're able to do that. We can tweak their medication to suit them, send it to them where they are. At the same time, we make sure we are looking at them holistically, not just about taking medicine. So we advise them that, for most of these chronic, the lifestyle diseases, lifestyle change is the cornerstone of management. And I'm sure Dr. Mokera will agree with this because it's what she preaches almost daily. So we tell them, please exercise, please, diet modified to your condition. If they're diabetic, if they're hypertensive, we're able to advise them. We take care of them mentally. Maybe a patient is feeling down. Oh, I have this condition now. I have to always see the doctor. I always have to take medications. We're able to assess that and tell that this patient can benefit from from having a consultation with a clinical psychologist. Therefore, this patient, we are able to retain them. Sometimes if a patient feels I have to board a matatu or whichever way a bus and go there every month, at some point they'll be like, I'm giving up. They get tired. True. So you lose them. But if
there's something about hospitals, by the way.
Yes.
I don't know if it's only me, but from the smell to the single type of conditions makes you even feel more sick, honestly.
Yes, that's true. So if we can do this from where they are, retaining them is much easier because they know the doctor is a phone call away. If I need advice on anything, I can call them and they'll be able to advise. So therefore, the condition is well managed because it's being managed at their comfort, at their convenience.
Okay, that's nice. I don't know about you, but mimi ni kama nita-adopt telemedicine because I'm not a fan of hospitals. It seems to work pretty well for me. And after the break, we'll have Solomon Munene. He's director, Kirugoya Municipality Boarding School. So he's one of the clients that actually has used telemedicine. Atatuambia, ataki kusikia tu hapa talk. It works well. You can see us very well. Solomon will actually tell us how it has been working, and he'll actually compare the before and after of using now this telemedicine option. Remember, this is Health and Wellness. Our WhatsApp line 0759-434389. Let us know if you have any questions about it. My Feet is definitely from Lugo Collection. Please check them out. They are located at Jivanji Street, Pale CBD. At Lugo Collections on their Instagram. If you need, ata hao pia wako digital. Si lazima uende huko. Actually, you can just holler at them. Their number is on their social media handles. They can create amazing pieces just like the one I have. So stay tuned. We're taking a short commercial break. We'll be right back.
StarTime's home solar solution with solar panels, hybrid inverter, and lithium battery, empowering you to do the things that really matter. A complete and reliable home solar solution. Call us today. StarTime Solar. Power your life.
Your Wealth in 20 Seconds brought to you by Standard Chartered Priority Banking. Benefit from expert investment advisory approach. At Standard Chartered Priority Banking, you have access to expert guidance and personalization. Through our robust SC Wealth Select Advisory Framework, we will help you grow your wealth for today, for tomorrow, and forever. Achieve your goals with Standard Chartered's expertise. Email wealth.kenya@sc.com today. Hii Krisi, sambaza furaha na Safaricom Business. Zidisha biashara yako na 25% off kwa business internet plans. Reliable internet ni key kwa biashara yako. Ukiwa na 5G speed na huduma za Safaricom Business, una hustle smarter, unawafikia wateja faster na kufanikisha mafanikio zaidi kazini. Dial *485# or visit www.business.safaricom.co.ke to subscribe. Safaricom Business, powering progress. Make sure your biashara shines this festive season. You are what you drink. Drink the best, made from 100% fruit with no added sugar or preservatives. Del Monte, real recognized real.
Well, in that case, I'll have whatever he's having.
I drink responsibly. Knock knock.
Who's there?
Del.
Del who?
Del Monte. Real recognized real. No added sugar, no preservatives. 100% real fruit.
Introducing Network. Accept multiple payment methods and process all your business transactions on one device. Network does it all. Get it for your business today by calling 0730-847-847.
Well, things are getting real.
We disagree to agree.
I think you are very wrong when you say everybody has WhatsApp.
A lot of people.
A lot of people. And the future voters,
Even
in another 10 years.
No.
In another 10 years, even 5 years.
And I'm saying so because I have numbers.
Guy, have you gone mad?
What is in the book? And I'm told it's mirror.
No. On this show, we say it in black and white.
We know very well how the vaccines are very helpful to our children. Actually, they save lives.
And for us, we go on. Yes, we're going to talk about you, mistresses, side chicks, all those other names that you're called. We're going to call them out. We're going to keep it real and let's be real. Sunday at 10 p.m. See you then.
Huku dunia ikiadhimisha siku ya virusi vya ukimwi baada ya miongo minne, tishio kuu la kudhibiti maradhi bado ni kasi ya maambukizi. Mto Yala na ziwa Victoria zavunja kingo zake na kusababisha mafuriko yanayoathiri makazi, huku wenyeji wakiomba msaada kwa mara nyingine. Rais William Ruto ashinikiza kwamba bima afya SHA ndio suluhu ya changamoto za afya, akikariri haja ya Wakenya kujisajili kwa wingi ili kupokea huduma bora za afya. Na pingamizi zaidi zielekezwa kwa serikali kutoka kwa kanisa Katoliki na upinzani wakitaka serikali kutimiza ahadi zake ilizowapa Wakenya.
Welcome back. If you're just joining us, remember this is Health and Wellness. My name is Zaitun Ali. I'm so elated that you made time to tune in, and each and every Sunday at 6 p.m. right here on KTN. And the topic of discussion has been telemedicine in Kenya. So how are we adapting to it? It's the new form of healthcare, accessing healthcare services remotely, digitally. You don't have to go personally to the hospitals just to see a doctor. Squeeze wanakupigia simu wanakuambia hello, how are you feeling? And they can even check on you anytime you have some symptoms. Just call them, you can text, and they even remind you of your next appointment. We've heard about it. So still in studio, I have Dr. Mukeira Gisairo. She is health advocate at Bion 8, and we also have Dr. Hadima Muroa. She's a medical officer from HealthX Africa. Now, these are two people who've actually owned the digital spaces in terms of healthcare services. And we have one more guest joining us, Solomon Munene. He is director, Kirigoya Municipality Boarding School. Hii iko Kirinyaga. Imagine amekuja kutoka Kirinyaga hadi Nairobi just for I'm special, guys. I'm special. Karibu sana.
Thank you.
Thank you. He is one of the people and one of the clients for HealthX who has actually embraced telemedicine. And we just want to know, especially how the students are taking it. Karibu sana. Najua hata hujapumua umeingia hivi kama umekuja hapa. But just talk to us about how you guys have embraced telemedicine.
Okay, thank you, Saitun, for having me here.
Yeah.
As you have said, my name is Solomon Munene. I am the director of a boarding school in Kirinyaga, Ashera Private School, Keruwa Municipality Boarding School in Kirinyaga. We are one of the big beneficiaries of telemedicine as an institution, and we are proud of it because we have got comparisons to draw the before and the after.
Now, wait, how did you even guys come to sit down and talk about it, how you want to start using telemedicine in the school? How did it even come about?
As a school, we are looking for a perfect solution to healthcare for students, especially the boarding section. And we were trying to come up with an arrangement with the neighboring hospitals where we can be able to send our students there very fast. They give priority to the students where they come for treatment, but that's not possible, in the hospital. So you have to follow the procedures, the queues. And therefore, one of the officers from the healthcare, HealthX Africa, came to us. And for us, we are open to new ideas. We have got an open door policy. So we just heard about the idea and we thought it's going to help us because of convenience. We don't have to take our students to the physical facilities out there.
Yeah.
They just get treatment right from the school. It saves time. Child goes back to the class and the learning continues without much interruptions.
I can remember our time during high school.
Yes.
Si tulikuwa na nurse mwingine hapo mpaka alikuwa anauliza, nurse anajua kitu anasema kweli. Anajua what she's doing. Because whenever you're sick, anakuetu Panadol, painkiller and that's it. Antibiotic, that's it. Mpaka ukue ile hali maututi, And one of the things actually students used to do is you go fake a sickness, unaambiwa sasa enda home, umepewa sick leave. So you are telling me nowadays, hakuna kitu kama sick leave.
Yes.
You being treated inside the hospital. Poleni sana. Really?
Yeah.
How efficient has it been?
It's very, very efficient.
Yeah.
Because for this to work, you need to have a resident nurse, a professional one, who is now the link between the school and the between the patient and the health the medical doctors.
Yeah.
It is now from the HealthX Africa. So this is how it is like. The patient, we have a clinic in the school fitted with those basic things for vitals and all that. So when the patient comes to the clinic, the nurse links the patient or the student with the medical doctor online on the other side of HealthX Africa facility, and we have a screen in the clinic. It's a screen. So the doctor appears on the screen and the student or the patient sits before the screen and they dialogue just as we are talking. The only difference is that they are facing to
TV. I was asking Adima, are you sure Daktari Atokea may shake in terms of internet, the connection is stable?
Yes, the internet must be stable. We have got out of back up on it, make sure that it is all the time stable. And of course, the nurse also takes the vitals, like the temperatures, its BPI and everything, and you will have sent those to the medical doctor on that side. So by the time that the doctor is appearing, he has got some background information about the medical part of that patient.
Yeah.
And therefore, the next is to just ask, just as the doctor asks you in the hospital, in the physical facility, how are you? How are you feeling? The student explains how he or she is feeling. The doctor notes on the other side. And after that, the doctor is able to do the prescription, which now the nurse takes it up to ensure that now the medicine is availed to the student. So the student goes back to class if it is not a very critical condition.
Yeah.
And then once the medicine comes at the same time, they are able now to take their medicine. And the good thing is that the same facility or the same nurse is able not to manage the drugs administration, because in a boarding school we do not allow the medicine to go to the dorms.
Okay.
Because the students can abuse them and even they can forget how to take them. So they follow and ensure that the medicine prescribed is taken as per the scheduled time by the doctor. And the parents are very happy because before they would, the way parents get a little bit worried, they hear the child is unwell. Now they have relaxed. They know there's a system that is working. And it's quite good. I would recommend telemedicine to any institution of running.
Okay, that's a good one. Yes. Dr. Hadima, and as he's talking, my question is, did you have to do training, especially to the students, before now they started using telemedicine?
For the students, not so much, because for them it's pretty similar to going to a physical hospital, only the doctor ko mbele ya TV. So they just need to come and tell the nurse, I'm not feeling well, I'm feeling this way and this way. And the nurse is able to link them up to us pretty quickly, usually within minutes. So for them it's easy. They just come, they have the consultation, and we are able to treat them.
So what device does the nurse use?
The nurse has to have, for the virtual consultations, she has to have the computer, so the laptop on her end, which, has an internet connection and a speaker and a camera so that we're able to see them. And that's about it.
Oh, really?
Yeah.
That's a good one. In terms of challenges, especially when probably the condition is very severe. So now how do you go about it?
They still appear before the virtual doctor.
Yeah.
And the doctor is able not to link them to another facility, but it is still under their treatment, so that in case there is a need for maybe for specialist treatment, they still follow it up. But those are very few cases that can happen. So I think for us, most of the students don't have very serious cases.
Okay, hey, we thank God.
Thank God. But when they come, you discover that most of the students also want to feel the feeling of the doctor. They feel when you're when you're a student, and they get, of course, the consultations and they get the treatment. But where there is some emergencies, you have asked, it's very critical condition, they are able to still recommend how to go about it. And but it's still their patient. So even that medication that is prescribed, it is they are able to consult with the doctor from the other end. But unless now the parent insists, that some parents who would come and say, now let me do what. But whatever they do, wherever they go, they consult with the facility, with the Health Act Africa, because at the end of the day, we are the people who are going to administer that medicine. From the school through the school nurse.
Okay, Dr. Mokera, we were talking about the digital divide before the break, but you see in Kirugoya, Nikirinyaga or Nikirugoya County, it's working pretty well. So clearly we are doing something right. So as we are looking at telemedicine in Kenya, so what are we doing right and what can we now improve moving forward to ensure the quality service is very efficient, just like the inpatient services that we used to have?
I think what we're doing right so far is starting to innovate solutions that are trying to bridge the existing gaps. So you'll find different organizations, either one person is addressing the pharmacy situation, someone else is focusing on labs, others are focusing on consultation, there's someone else who's doing an all-inclusive platform. So I think what can be improved on is to improve on these individual solutions. At the end of the day, try to make them as interoperable as possible. If I've been seen in a particular facility, if I go to a different place tomorrow, are they able also to retrieve my data? Am I going to start from zero? So I think eventually what needs to happen is, even in partnership with the public hospitals, private hospitals, is to create a central interoperable system where whatever I'm seeing, we're using the same kind of information. The doctor who sees me there knows exactly what was happening with me from JAM.
Okay, that makes it. So right now, does it keep the history of your illness and your medical history?
Yes, your medical history is stored. So when you see the doctor the next time, they know what exactly was happening with you, and you have the option to see one consistent doctor. So you can choose that.
Okay,
you want to see Dr. Mokera, you will walk
Kila
your
mtu
journey.
anakuchaguanga pia wewe. I see when I see you on Instagram, you looking fine over there. I want to see her.
You want to see Dr. Mukera? Yeah. So you can, if you want to see Dr. Mukera, you can choose to stick with Dr. Mukera throughout the journey.
Yeah.
Sometimes health concerns are sensitive, and you might not want to start telling someone your story, especially even for mental health.
Exactly.
You don't want to start telling someone new every time what your issue is. You kind of build that relationship with this one person.
Yeah.
So there's also that option of choosing which healthcare provider you want.
Okay. And Bona Director, even as we're talking about mental health, especially high school, oh God, it's been tricky. So do they now even take up counseling services? How does it go?
Yeah, and that is also part of the benefits that we are doing from the HealthX Africa, the counseling part of it, because mental health is also a very big issue to the students.
Yeah.
Where we are coming from is that children, no one ever thought that they could have any issue that is stressful to them.
Imagine.
And we are told that, just like a good example is that you are relocating from where you live, you are to another estate. You don't take note that the children are affected because they had also built their own social networks, even their friends.
Yes.
So when they relocate, they go to other places.
It's a disaster.
And of course, the education part of it, the pressure part of it, academics. That is why we had to change the system of education from that which was exam-oriented and putting so much pressure on high grades. And that was also putting a lot of pressure to the students, and the stress, mental health issues were very many. So also we thought that we also think with the time, the current education system will be part of the solutions to mental health for the students, because the pressure has been real. So once there are those issues of counseling, we are also able to organize with the facility. They are able to engage, and then the nurse is also trained as a counselor. Also, is able now to follow up the cases, and it's manageable.
Okay.
Yeah.
And a good question to both of you doctors: is this service actually catered for in our health insurance? You can start, Mukera.
Okay. I think it depends on the particular organization.
Okay.
Specifically at Pioneer, one of our offerings also, we have medical subscription packages.
Okay.
So for example, you're able to pay $2,500 per month, and then you get access to unlimited outpatient care. So yes.
Okay.
And that caters to all the consultations you'll have with the doctors, the GPs, that is, the specialists, whether you need to have any prescriptions fulfilled, whether you need to do any lab tests or imaging, that is all encompassing.
By specialists, you even mean gynecologists?
Yes, gynecologist, dermatologist, whatever specialized care that you may need.
Yeah.
So Inform, that is an insurance kind of medical cover or medical subscription package that we have that caters and addresses that financial aspect of it. It also has a tie-in with inpatient insurance. Sometimes if you need both outpatient and inpatient, we're able to get into partnership with one of the insurance providers, and they're able to give that all-encompassing coverage. So yes, I would say that
that's a good one.
Yeah.
And for you, Dr. Adima?
Yes, at HealthX, we also have a similar subscription model. So the patient is able, depending on their needs, they can, have a one-time consultation. They can have unlimited consultations for a certain amount of time, depending on how they want it themselves.
Yeah.
And on top of that, we've partnered with the major insurances in the country. So a patient who is covered by insurance can have their consultations, imaging, lab tests, and the prescriptions paid for by the insurance.
Okay.
Yes.
Okay. Honourable Director, is there anything that you can actually recommend for this telemedicine, maybe for them to make it better in terms of accessing services?
One, we need to create more awareness.
Okay.
To the parents, and I think this kind of a show is one of the initiatives that will go a long way to assisting the parents and the members of the public about what is all this about telemedicine and how it works. So thank you very much, because
we are doing it right now.
So creating awareness, because that's to me the biggest difficulty, because where we're coming from, you're used to the physical doctor. And it is like the parent is not believing that, hi, my child has been treated. And why is the doctor disappearing the screen? How? So that is the biggest to me challenge. Of course, as Dr. has said, there is a need to also to bring on board as many insurance companies as possible.
Yes.
So that, the parents are saying, we have got a medical cover, I don't need that one now. So that when there is that consultations bid at the drugs, it automatically now, whatever they got to take the drugs and everything, they are able to, this is also covered. And of course, I think the internet is part of the parcel of every service in this country. Call it medicine, call it anything. So I think that is good to support that infrastructure, and internet connectivity. Because if you were to have the situation of learning and enjoying the same facility, and you can imagine there are those in remote areas which will have those challenges and they may not have that kind of infrastructure. So I think so that's why the government and the other authorities also are part and parcel with it, because we are saying that telemedicine is helping us increase accessibility to health and medical treatment. And you look at the constitution, and I believe Article 53, that health care is guaranteed to Kenyans, to citizens, and to students, the children. So if something is going to increase that accessibility, that somebody doesn't have to travel 20 kilometers or 10 kilometers to access that medication, I think that would be a very good thing. So some countries who have started embracing, I think they can talk more about that. And that is a good thing.
Okay. Dr. Hadima, especially in the rural areas, if I may say so, away from Nairobi, how are people accepting this telemedicine, and do they encounter such technical difficulties? If so, how do you ensure that you guys are working on it?
Actually, we have seen quite an uptake of, this telemedicine service outside of Nairobi. So we get calls from everywhere. We get calls from, Northeastern, we get calls from Turkana, we get calls from Narok, from, places which are considered remote, especially in such areas where it would be difficult for someone to travel to a physical doctor. They can actually call us and have a consultation with us. And how we've managed, to make it easier for them, because not everyone might have a stable internet connection, is they are able to just call normally through our toll-free number. They don't, for the initial consultation, they don't necessarily have to have an internet connection just to talk to the doctor initially. Of course, if we are to send documents to them, we will need to do it, using the internet. But that can always be arranged, at least after the first, consulted with the doctor and, have some medical advice and be told that this is how we're going to go about it. So yes, people are accepting these services outside of Nairobi, and it's making life easier for them, because, I don't have to, maybe if I'm in Kakuma, for example, I don't have to go the way to Eldoret maybe to see a doctor. I can have a virtual consultation with Dr. Hadima. Yes, and my needs are sorted through HealthX.
Okay, that makes sense. A toll-free line. So aside from that, consultation, you pay for you to access the services. Seeing a doctor, you pay for it.
Yes.
Okay, so via M-Pesa or mobile services, mobile money services.
Mobile money services, if it's cash, that is. But if they have insurance, then we take care of that for them.
Oh, that's fine. And for you, it's an application?
Yes. Currently, the solution is hosted on an application.
Yes.
So the user has to have stable internet connection.
Downloaded on Play Store?
Yes,
App Store.
You can download it on Play Store as well as App Store. Going back to the internet connectivity challenge, I feel like when we piloted the project in Murang'a County, what we're able to see is when the county government is also in support of these initiatives, they're able to set up backup internet providers. For example, like Starlink, they had that backup provision to ensure that whenever the patient's having the consultations, the internet connectivity is always stable.
Oh, nice.
Yeah.
That's a good thing to hear. Na pia sisi tunaomba Kirugoya internet filter itabehave. But meanwhile, so far, the students are enjoying the services.
Yes,
okay. And wanasema at least kuna change. You said there's change before and after.
Yes, because before we could take almost all day when a student is taken to the hospital. We cannot go and dictate how treatment will go in another facility. So it saves time. And for cost of it's more affordable for the parents, because consultations are very expensive there. But here, it's a one-off payment, a very little fee that goes for a whole term, and it doesn't matter how many times you visit. Consultations is taken care of, so it's more affordable. And of course, the parents are sure. That's assurance for the parents that my child is taken care of. When the child is that's a very big thing for us as for the parents.
Way to go. That's a good idea. You guys embraced, and we are really grateful. At least we are digitizing healthcare services. Just what we want is for you to access the best and quality healthcare service from wherever you are. So thank you so much for tuning in to Health and Wellness. I hope you've learned a few things here and there. So they can find you Byon, BYON. 8.
BYON number 8. Yes, you can download the app on Play Store or App Store. You can also see what we're doing on LinkedIn and other social media pages like Instagram.
And your personal page?
My personal page is Dr. Mokeira Gisairo. Search me on Instagram.
Sawa sawa. Hadima, Health
Yes, they can call us on a toll-free number. They can,
which is you've been saying too. Umeshika. Acha tukangalie pale kwa mtandao.
Hapo itabidi mkaangalia pale kwa mtandao. But it starts with 0800.
Okay. Wow. Sawa.
Yes, we have an app, HealthX app. It can be downloaded through the Play Store. Yes, to be able to access our services. We have an Instagram page, we have a Facebook page, we have a TikTok page, and all our services are there.
Thank you so much. Guys, you can find this episode on YouTube at KTN Home. Find me at Ali_Zaitun. Kama vile nimewambia pia mimi suti yangu mtaipata pale kwenye mtandao at Lugo Collections. He does an amazing job making us look good and beautiful. Thank you, Bwana Director, also for coming through. We appreciate it. Until next time, Kesho, stay tuned. KTN is doing an amazing thing. The new KTN. Stay tuned.